initiating a smoke-free environment, the apartment owner or the condo association manager, they are really saving themselves lots of money.
What the building owners are finding is that they're drawing tenants for longer terms, better tenants, getting higher rates.
A money saver for the owners, and it could also be a lifesaver for the tenants.
Giving the majority of people out there a healthy alternative, that they can live in an apartment and not have to worry about when their neighbor's smoking.
We're hopeful that in the long run this will make a big impact on the health of our community and have an impact in reducing chronic disease and early death.
There is a competent community organization out there, such as the American Lung Association, as well as our Tobacco-Free Partnership, that's actually working on this, that, hey, it's not only easy to do, but you have a partner out there that will help you.
People don't realize that there are huge economic side effects.
When somebody's a smoker and they've been in a unit for a number of years, you're going to have a lot more work to do in terms of turning that unit over and getting it cleaned up. It's a much larger expense than if you had a non-smoker in there, and that's a proven statistic.
Doubles to triples the amount of rehab for a smoking unit than it does for a non-smoking.
There's actually a study done by a group called Smokefree Housing New England. What they have found is that these costs could be between $1,800 to $3,500.
And even though you change the carpet, you paint the walls, you replace the appliances, you can still gonna smell that. It still affects the next resident that comes in.
You're going to have less complaints from your non-smoking residents. So that's time that your business manager, your property manager can use doing something else. So it's going to save you money and productivity there.
In times where, frankly, federal subsidies have become less and less, the more money you can save on some other type of initiative or another end, that's just more money that you can use then for your property and to help maintain your property.
If you work with us and on this policy issue, we can save you money.
Well, we speak about risk with a smoke-free multi-unit housing. Of course, the issue of fire safety comes into mind. 92% of all smoking-related fires that occur inside these indoor multi-unit housing complexes are non-confined, meaning that they spread from unit to unit.
Smoking is one of the #1 sources of fires after kitchen fires. And then you also have possible insurance rate reductions as well. And hopefully the insurance industry will catch up a little bit and begin to offer deeper discounts for properties that go smoke-free.
We have to consider that this is elderly, and sometimes they fall asleep with the cigarettes.
They tell us we can't have candles, we can't have, things like that, but they let these people smoke, and I've seen some of their apartments where their carpets are burned from where they've dropped their cigarettes.
I feel safer when I go home at night and go to bed. I feel safe that I can sleep.
The architecture of multi-unit housing is not designed to contain or keep out cigarette smoke. So anything that first-hand smoke can do, second-hand smoke can do. There's no safe limit. There's no threshold below which we know there's not going to be any disease with tobacco. Even a small amount of second-hand smoke can increase your risk for a heart attack. Second-hand smoke can lead to chronic obstructive pulmonary disease. Americans do die from lung cancer each year because of second-hand smoke exposure.
Smokers tend to have more sick days and they miss more time at work. Someone who lives with a smoker and who is subject to secondhand smoke may have as many sick days as that smoker.
I didn't realize until I quit smoking just how dangerous the secondhand smoke was. My brother was married to a smoker and he has severe lung problems and he's never smoked a cigarette in his life, and the doctor said it was due to his secondhand smoke.
I went ahead and quit, yet I ended up with COPD anyway because of other people smoking around me.
Catholic Housing was very interested in exploring a smoke-free policy.
The American Lung Association assisted us in putting together a list of partners that would help us explore this. One of the partners was from Nova University, which actually helped us to do a survey of the staff of the residents.
And what we found was really startling, that there was a vast majority of residents that wanted these policies, and that includes I think about 40% of people who actually smoke cigarettes.
It was kind of like once we gave them the Catholic Housing the results, it was kind of an eye-opener for them because they didn't realize how much support that they had. They thought it was going to be a lot more challenging, and they kind of wanted to speed up the process because of that.
Implementation was a lot smoother than I thought. We had a lot of staff participation, resident involvement, and it made it smoother than I thought it was going to be. It wasn't that we wanted to tell people, okay, you need to quit smoking. We were telling people we want to provide a housing environment where our residents can breathe easily. So no smoking allowed in our complexes. I think the majority were very pleased about the outcome. I think a lot of the calls that I was getting was, thank you so much for doing that. I feel so much more comfortable with where I live now.
Yeah, I think it's one of those things that sort of get the ball rolling, and the American Lung Association and others have helped to get the ball rolling, and once it does, and people begin to see those success stories, that's when it begins to grow on its own, and it's almost an organic process at that point, where you're going to see a lot more property owners come forward and say, you know, we want to do the same things. We can save money, we can improve the health and well-being of our residents, and I think it's just a win-win situation for everybody.
When you're providing affordable housing, you're always looking to make sure that you're doing cost savings, and this is one of those areas where we not only help the residents to breathe easier, but we're also going to be saving money in the long run.
A couple of years ago, I developed a toolkit for owners and property owners to be able to formulate smoke-free policies within their units, and it's been, I think, an invaluable tool for these landlords and owners.
It talks about the health consequences of secondhand smoke exposure. It talks about the way and how tobacco smoke spreads from unit to unit. It talks about the costs. It talks about the legalities of it. It talks about how to go. For surveying people, communication you want to check as far as sending out letters.
And also make sure that they have the guidance and support that HUD can provide to them, not only for HUD-assisted, but even for non-assisted properties. And we've seen recently a lot of private owners who are not subsidized, who are just market rate developments, are now going smoke-free as well because they see the financial benefits.